Hello everybody, this is Dr. Jazayeri. I wanted to talk to you about something that I don't think anybody has talked about, at least as far as I know, about choosing a plastic surgeon for your procedure. And so, as I've said before, try to find a board-certified plastic surgeon with a few, with years of experience. Experiences, I think, is really important. Make sure you do have a connection with them, you feel comfortable with them. Look at their before and after photos, make sure you like the vision or the style of that surgeon. And most people talk about that. But then after that, I think it's important also to look at their kind of customer service after the procedure. A lot of people, for example, talk about Dell computers, and there are very good computers, but there are a lot of other companies that make good computers. But what Dell kind of set them apart was their customer service in case there was a problem. The same thing with department stores like Nordstrom, Louis Vuitton. These not only they have good products, but their customer service is really top notch. So our policies, or my policies, within the first year, if a patient has a complication and they require, an additional surgery, I pretty much all the time, I don't think of any occasion when I've not, but I typically waive the surgeon fee. And my rationale is, well, this patient spent a lot of money. The complication really wasn't their fault or my fault. These things sometimes happen, so I'll try to help him out. Now, obviously, the patient understands that there is a fee for the anesthesia operating room if they require general anesthesia, or if we do it in the procedure room, there's a procedure room fee to cover supplies and some maintaining the procedure room. After the first year, we do charge because that's already a year out. When will I not waive the fee? The only scenario that I can think of would be for a breast augmentation patient. I spend a lot of time going over the cup sizing, how cup sizes work. Then I have the patient try sizers, and they can play with all kinds of sizers. The one with the bra, with the shirt. However, I even take pictures for them, and they, so they can look at the before and afters. And then we document the implant sizes which were picked. And then on the day of surgery, I also write down again those sizes on the consent, and the patient signs it and dates it. So if 6 months later the patient is not happy because they feel these implants are too big or too small, I don't think it's fair for me to waive my fee. That's like an example would be if I hire a contractor and I change my flooring, right? We picked a certain flooring, and then everything was done properly. The contractor delivered what was promised, but then 6 months later I want to change it to something completely different. Well, I don't think it's fair for me to expect the contractor to not charge me for the whole thing. It was just my taste changed. But I think it's important, once you're looking at a surgeons and you like them, also look at their financial policies. They should be clearly written in writing. Don't take anything verbal. Make sure it's in writing and they clearly state what's covered or not. Some doctors argue that complications do happen. It's nobody's fault. The patient signed a consent, and so they do charge to treat complications. So you want to clarify that, before the surgery, and that's okay. That's just a philosophy of the surgeon. There's nothing wrong with that. I'm just going over what my philosophy would be. All right, well, I hope that was helpful to you. Take care and be safe.